My name is Henriette Callison, and I'm a part of the National COVID-19 Clinical Evidence Task Force. In this video, I will talk to you about the recommendation, what types of recommendation are there, how can you construct one. So there are two different scenarios to consider when constructing a recommendation. The first scenario is that you have a clinical question which leads you to search for literature and to select studies. You then end up with an evidence profile with all your results combined for this particular clinical question. And you therefore end up being able to give a recommendation that has a direction to it, so for or against a given intervention, as well as a strength, so either a strong or a conditional recommendation. There is, however, also the possibility that you have a clinical question. However, when you perform the literature search and potential study selection, you end up not finding any evidence relevant to your clinical question. In that case, you will end up being able to give a recommendation that is a consensus statement. So in another video, I talked to you about the evidence to decision framework, and this is a framework that constitutes of 7 different factors that you need to consider beforehand when you are seeking to construct a recommendation. So that includes the benefits and harms of the intervention, the certainty of the evidence, the patient values and preferences, as well as the resources, equity, acceptability, and feasibility of the given intervention that you are looking into. Now, based on scenario number 1, where we end up having evidence from which we would construct a recommendation, in that case, we also need to give a strength to the recommendation. And here there are 2 possibilities. So you may be able to give either a strong recommendation or a conditional recommendation. So I will walk you through the different types of recommendations that we have. First and foremost, we have a strong recommendation for a given intervention. In this situation, the benefits and harms, the overall benefits that we see from this given intervention are clearly greater than the undesirable effects. In terms of the certainty of evidence, we have either a high or a moderate certainty. And when it comes to patient preferences and values, we would have a good reason to believe that the majority of patients would want the recommended intervention. So in this circumstance, in this case, we would end up being able to give a strong recommendation for a given intervention. There's also the other way around, so a strong recommendation against a given intervention. And here, the benefits and harms, we would see that the overall harms are clearly greater than the benefits of the intervention, and the evidence essentially shows that the intervention may not be safe. The certainty of the evidence will be high to moderate, and there would be a substantial confidence in the magnitude of effect. And when it comes to patient preferences and values, there would be good reason to believe that the majority of patients would not want the recommended intervention. So that was the strong recommendations. We also have the conditional ones, and they may be a bit more difficult to grasp. The first type of recommendation we have is the conditional recommendation for a given intervention. Here, the benefits are greater than the harms, or at least the available evidence that we identified cannot rule out a significant benefit of the intervention alongside few or at least absent adverse effects. In terms of the certainty of evidence, we have a low to very low certainty, and when it comes to patient preferences, we would have a good reason to believe that the majority of patients would want the recommendation. The other way around, the conditional recommendation against a given intervention, the harms would be greater than the benefits, or at least the evidence would show that the intervention may not be safe. The certainty would be low to very low, and in terms of patient preferences, there would be a good reason to believe that the majority would not want the recommended intervention. So how to interpret these conditional recommendations? They may be a bit tricky. A conditional recommendation does not necessarily mean that there is a lack of evidence supporting the suggested course of action, so the suggested intervention. Reasons for constructing a conditional recommendation would be that the evidence is of low quality, so it's hard to be sure. Therefore, you wish to have a conditional recommendation. There may be a fine line between benefits and harms. It's difficult to kind of say if the benefits very much overweigh the harms and vice versa. There may, however, also be other factors not relating to either the quality of the evidence or the benefits and harms, but for instance, factors such as patient values may necessitate that we have a conditional recommendation instead of a strong recommendation for a given intervention. So here you would need to consider individual patient factors when applying a conditional recommendation, and a shared decision-making would be mandated for most conditional recommendations. Then the conditional versus the strong recommendations. Well, normally there would be a high certainty evidence. This would potentially lead to a strong recommendation. And if we have the low certainty, well, then this would indicate that we would give a conditional recommendation. However, there are deviations to this. We may have high level evidence, however, still we may end up giving a conditional recommendation. And this, for instance, could be if there are any variations in patient preferences or other factors. It may also be that we have a low evidence, but still we end up giving a strong recommendation. And this would be the case if patients are expected to highly desire the intervention, if it's a potential benefit in a life-threatening situation, if there are any substantial harms that we really need to pin out, or if there's other factors that talks into giving a strong recommendation despite the low evidence that we have. Then there was also scenario number 2. So that was when we were not able to find any evidence supporting this look into the intervention. So that would be a consensus statement instead. So the evidence is absent, but the panel may still want to give a recommendation. Well, then the recommendation itself would be based on clinical experience. And here, patient preferences and the other factors that are part of the evidence to decision framework, they still need to be considered. The recommendation will be clearly marked as a consensus statement since it is not based on evidence, it is based on clinical experience. So for the recommendation, we have these supporting materials, we have the key information, so the evidence to decision framework that we will be going through in order to consider what kind of recommendation do we want to end up with. There's also going to be a rationale describing on how factors were weighed in relation to one another and how it resulted in the strength and direction of the recommendation. And there's also going to be, if needed, some practical information supporting the recommendation in the end. So that was it. Please do follow us on Twitter and visit our website for more information. Take care.